How do we get to a situation where we can have nuanced conversations and caveats? Because I feel like the inclination from public health experts is to like do no harm, have declarative statements, as to not confuse the people.
That perspective, although it is about these kind of health topics, was something that it really came to out of COVID. And I think I spent an awful lot of time during COVID talking to people about kind of how to think about public health messaging and like sort of how to and trying to do to some extent some public health messaging, which was meeting people and and trying to help people prioritize in a world in which it's sort of like you're seeing there are a lot of different choices and you have to figure out which things you want to do. I think public health messaging during that period was poor and or at least made many mistakes. Let's put it that way. And I
Yeah.
think they were kind of many mistakes which they made over and over again, which was thinking that people would just do the thing you said and that you could just make statements and say, I'm totally sure about this. And then the next day be like, just kidding, it's a different thing. I'm totally sure now. And that people would be like, okay, well, you're the expert. And I think that's just not where people are. RFKs, and there's many things with the vaccines, but one of the things they did with the vaccines was say basically healthy kids should not get COVID boosters. And there's like a petition from a bunch of public health things that's like, we're going to sue so healthy kids can get access to COVID boosters. If you want your kid to get a COVID booster, I think that they should be able to. But I think that feels to me like a focus, which is not very helpful because it's like actually measles vaccines are super important. And healthy kids, who are 7 getting a fourth COVID booster is actually not that important for public health. And when we focus on every tiny little thing and make every little thing the most important thing, we're dying on every hill, we kind of miss the hills that are most important.